you everybody for coming. My name is Eric Meyer. I'm a professor and the Dean of the School of Information at the University of Texas at Austin. So I'd like to welcome you to the newly created Information Roundup iSchool Conversation Series. This is an opportunity to examine relevant and timely topics or challenges from an information lens and offer solutions, best practices, further action. We plan to hold discussions on timely topics, such as today's, once or twice per semester to start discussions of interest to our alumni, students, faculty, and friends of the iSchool. So here at the iSchool, we've had to make many shifts over the last 7 months. After shifting entirely to online teaching in the spring, we're now offering the majority of our classes online, with about 20% also have an in-person component. The iSchool staff spent their summers preparing for a mostly online academic year, all while changing their own working patterns to work from home and to stay safe and to keep others safe. We're reconfiguring the ways that we meet, that we socialize, that we bring new faculty, staff, and students into our community. We have innovations happening across the board to stay engaged, to stay engaging, and to keep our scholarly community vibrant. On March 13th of this year, iSchool professor Bo Shi and 10 of her colleagues published an article in the Journal of the Association for Information Science and Technology, JSIST, titled "Global Health Crises Are Also Information Crises, a Call to Action." It was March 13th. In this paper, Professor Shi and her colleagues forcefully argued very early on during our experience of the current pandemic that we were in the midst of a global information crisis. We're picking up on Professor Shi's theme tonight, exploring issues of lost data, misuse of information, privacy concerns, and access to reliable data and information. I'm joined today by two UT Austin iSchool alumni, Dr. Susan Cisco, who's a Records and Information Governance Consultant, and Sue Trombley, who's Managing Director of Thought Leadership at Iron Mountain, and also a member of the Advisory Council for the School of Information. I'm so pleased that they've agreed to join us to share their expertise and knowledge of how COVID-19 is changing the ways that organizations are keeping the records and maintaining accurate and accessible data during this global health crisis. We're also joined on the call and in our discussion by UT Austin faculty member, Dr. Kieran Trace. Dr. Trace has extensive expertise in research that informs her teaching in the archival enterprise space. She's also the editor-in-chief of an international journal house here at UT Austin, Information and Culture. iSchool Director of Development, Shannon Hickson, and our Development Associate, Jess Isaacs, are also on the call, and they'll be monitoring the chat and will be available to assist. So tonight's format will be a mix of a couple of different things. We'll start with Sue and Susan sharing some of their recent experiences and knowledge and help us all understand how organizations are responding to COVID-19, working from home, and the ever-changing information landscape that we find ourselves in. Then we're going to have a bit of a discussion picking up on some key issues. Finally, there's going to be time for questions from the viewers. Please post your questions in the chat and we'll do our best to get to as many as possible. Also, if I could ask you during this first part to leave yourself on mute and to turn your video off if you're one of the guests, so that we can focus on the people who are presenting. And then when we get to the discussion part, we'll ask people to uncloak themselves so we've got more people on screen. So without further ado, I'd like to hand over to Sue and Susan, who are going to help us all understand more about COVID-19 as an information crisis. So over to you.
Thank you, Dean Meyer. And I just have to tell you that JSIST article, it's like the last thing I printed before COVID, just at the cusp. And I've quoted it and I've used it countless times, as probably Susan's heard on many of my webinars and educational blogs, but I really do believe that global health crisis is indeed an information crisis as well. So thanks for the introduction. And if you could just indulge me for a moment, I wanted to share an iSchool story. So it's no accident that we've got Susan on the roundup with us today, as Shannon and I were talking about starting this program. Over the past 18 years, Susan's been a mentor. She actually helped launch my career at Iron Mountain. We've been professional collaborators and co-presenters at countless ARMA chapter and conferences and other venues as well. But most importantly, Susan's a dear friend, not only to me, but to my family as well, and to friends who are on this webinar with us tonight, or this roundup with us. But that all started when I took her notoriously dreaded records management course. Karen, I hope that you don't live up to Susan's standards, because nobody wanted to take that course. But that's where it all started, and that's where we became friends, lifelong friends. And so I just wanted to tell a happy story of the magic that can happen at the iSchool, because it's made a profound difference in my life, not only professionally, but in a personal way too. So thank you, Dr. Cisco, for all of your support over the years.
May I add to that?
No? Yes, of course.
So I had forgotten when Sue graduated, and she told me today it was 2003. And that was actually, I taught records management, sometimes an imaging course, for 10 years. And 2003 was the last year that I taught. And over those 10 years, Sue was an extraordinary student, a very memorable student. She already had established a software company, a successful software company. So she came with a lot of business acumen and motivation to change her career. And I was delighted to have her in class. Then she invited me to her graduation party, and that was there that I got to meet her family, and it was really there that our friendship began. And we have traveled some together. I'm from Iowa, so I showed her the Iowa State Fair, and she introduced me to the Northeast, which I had really never been to so many of those states, Rhode Island and Connecticut. So it is, as Sue said, it's an experience that I'm forever grateful that I was there at the iSchool and that we had the chance to meet.
Thank you. Thank you for indulging us, Dean. So I think I'm going to ask the questions actually, because okay. So one of the most profound disruptions certainly has been the shift for the majority of people around the globe to work from home rather than in their offices. And just a couple of days ago, Microsoft joined with Twitter and Facebook in saying that employees could have the option to work from home on a permanent basis. So what we wanted to discuss firstly is just what that means to the impact on managing information throughout its life cycle. How does it change? How do we continue to conduct our business, which in many ways is supporting the business of where we are employed? And just that it's never going to be the same as it was before the pandemic. So Susan, I'm just going to start off with talking about Forrester Research latest output on COVID-19. And they say it's a drama that's playing out in 3 acts. The first act is respond, the second is to renew, and the third is to reinvent. And in my experience, and I'm sure yours as well, that organizations have really been on quite a journey since the stay-at-home orders were issued, wherever they are in the globe. So resilience was a word that we heard over and over again, and it's kind of quieted down now, but right off, organizations found that they really weren't resilient in many ways. And one of the first challenges they had, of course, was with technology. As they sent employees home, do they have a company issued device? Do they just have personal devices? If they have personal devices, how do we make sure that we can use those personal devices in a safe and compliant way? It's just been a nonstop process here. And it truly is amazing that organizations weren't crippled. One of the interesting things that we heard on a call with the interim president at the time, now the president, is that on the first day that UT went live, fully live, it consumed 8 million Zoom minutes in one day. I did the math, and that's plausible given all of the students that would be using that tool, and it didn't crash, and it hasn't been crashing. So, but in any case, maybe you can help me just talk about what the technology issues are, how it's focused on changing processes, especially around paper-dependent processes. Could you just comment on what you've been seeing around the impacts that COVID has had on how we manage information remotely, with technology that may be new to people, always thinking about privacy and security? Anything that you can share around that?
Well, what information governance professionals are telling me is that they need to manage the entire life cycle of information. That's been a given about all information, but it's extremely important with pandemic-related information. And although it's not very sexy or very fun to talk about, the essential foundation is policies, procedures, and processes. And if you don't have that for COVID-related information, people are not going to be confident to know exactly what to do with records and information that they create and acquire. And what my clients are telling me is that they assume they're keeping everything. They don't know exactly what to do. They're at home by themselves without much direction on how to manage the COVID records or the records in general, because they're so decentralized. And that without that structure and without that framework of rules and an understanding of managing the life cycle, people are keeping everything. And one of my clients told me that, I mean, they can see it in just looking at the bits and bytes that are stored. They just are increasing dramatically because nobody's getting rid of everything. Now, so what's the big deal about that? Well, over retention is a real problem for organizations for a couple of reasons. One is that it makes it really difficult to find things when they do need to locate information, for example, just to get their work done or to be able to produce responsive information in a litigation or any kind of investigation. That's a real problem. And in addition, it makes it, when there's so much duplication and so much volume, it makes it very difficult to deal with privacy requirements, such as people requesting, and because COVID-19 information, a lot of it is very personal information. It's medically related information, it's confidential information, that it's when there's so much information being stored in so many places, it's very difficult to comply with requirements. For example, requests for people that want to be forgotten. It's very difficult. So that's been the major thing that I've observed, is that we've got to get our arms around developing policies and procedures and processes for these kinds of records as we have for others, or it's just going to be very expensive and very time consuming to manage both paper and digital information.
So this intrigues me, because in some ways we're talking about two different tracks here. We're talking about the records and data that are being created specifically related to COVID. And then the other track is the information, the quotidian, the everyday that is being used to run the bank, to support the manufacturing floor. So it really surprises me that keeping everything is something new or different, because as you and I both know, that for ages, at least 75, 78% of organizations never got rid of anything anyway. And that's paper, and it's made obviously more difficult with electronic data, right? So I just find it fascinating that is considered something new or different related to COVID.
So what would the explanation be for?
I don't know. Because I mean, the same things should be available depending, I mean, if somebody's storing their records in a SharePoint site or with open text, that the same routine should be happening for destruction. So that's I think that would be an interesting one to pursue. And in terms of keeping everything, I do know that there's such a pretty significant decline in the use of paper. Certainly Iron Mountain and most regulated organizations that I've been working with, you can't even print from home, right? If you want to print from home, you have to get special permission for your printer device driver to be loaded to whatever device you're using. Now, that doesn't mean that people don't work around it. They send their attachment to Gmail account and then print. But again, banks, insurance, whatever, they're not even letting people do that. They're tracking that. There's a whole system of surveillance in effect to prevent that from happening, and then leaving those shadow records on somebody's laptop, which shouldn't be there, because since March, there's been a 4,300%, that's 4,300% increase in spam, because everybody knows where the vulnerabilities are. And I see Karen shaking her head because, I mean, that's a ripe material, all that data in motion. Who wouldn't want to try to hack it and grab it and then do all sorts of nefarious things with it? So that's been a big barrier, and one that it's taken, at least in my experience, organizations a lot of communication and a lot of, as you say, adjustments to policy to be more explicit about how you manage that information, whether it's physical or digital, when you're working from home, to avoid these things. Because even if you have a Google Dot or Alexa sitting on the shelf, she's listening in all the time. And that was one of the things that we was really quite surprising in March. It's like, don't share your private information, certainly around your family or around Alexa, because she's storing all of that. So, you know, we've really had to learn a whole lot in a little time in terms of how to keep everything safe, as safe as we can. So I think that one's interesting.
Somebody making a comment?
Yeah, I mean, if I could jump in with that, I mean, I think that raises an interesting point about personal data, right? You know, the whole question over personal data, I think we've become more aware of it being gathered, you know, with employers, governments, retail establishments that are collecting data around health surveillance. But there's a balance there, obviously. So at the University of Texas, we've got this Protect Texas app. And the Protect Texas app was designed to favor privacy over intrusiveness. So iSchool faculty member Eric Nordquist was involved in setting that up. And it doesn't share data centrally to a cloud or anything else. It stores the answers to people's questions about whether they've had symptoms only locally on their phone. Now, some other organizations have gone the other way, say, give us all this data because we need it to be able to track everybody's movements. So what do you think information management professionals have already learned? Because we've already been dealing with sensitive health information for many years, or other kinds of sensitive information. But I think what's happened right now is a lot of organizations have had to quickly make things up to deal with the changing landscape. And now that we're 7 months in, people are starting to step back and say, okay, we've been making stuff up for a while. Maybe we should actually be a little bit more systematic and thoughtful about this. So what kind of messages do you have to help people as they make that shift into going toward best practices rather than going toward what will get us through the next couple of weeks?
Yeah, I think it's a really right on observation, Dean, because on many fronts, because organizations have really accelerated so quickly in order to fill those gaps. And we just conducted some research that said at least 50% of those organizations realize that what they put in place isn't going to be sustainable going forward. So while they're, you know, on the track of digital transformation, it's not necessarily going to sustain itself over time. But that question about what we as information management professionals should be doing at this point in time, I'll kick off and then let Susan join. But there is that conundrum, privacy versus transparency, that we've been talking about since this hit. And there's some very interesting things going on. I was reading this morning about how there's a manufacturing company in Malaysia that has an app, it's Bluetooth, and it actually tracks the person, as I walk through the factory. If I get too close to someone, it tells me you're too close. If my temperature goes up, it tells me report to the clinic. It knows where everybody is at every point in time. And while that is helpful in keeping everyone safe, not everybody wants to be tracked every moment of their working day. So one of the things that I found interesting is MIT has a database of all of the apps that are being created, because there's a plethora of them out there, right? Everybody's jumping in. PwC has an app. I mean, organizations that you wouldn't think would even be making software. But MIT does have a table that shows all the attributes of the different apps, whether they're GPS tracking, whether they're Bluetooth, whether they send information to the cloud, whether they leave it, like you say, remote or dependent on the device. So there's a lot to be understood about the applications that are being adopted by companies. And information managers aren't always in the mix, right? As you say, I mean, they had to get something out the door quick for health surveillance, for contact tracing. And I do have to say, 99% of information managers were not involved in that selection of technology. So there's a lot of backtracking to put in those privacy controls, but it's a vulnerability without a doubt. And there's a really interesting ethical conversation to be had around what then organizations do with that personal data. Do they keep it? Are they using it for the wrong purposes? And I think that that's just begun. And Karen could probably comment on that too, because we're going to see more of those questions as we get through COVID. We're just still in the midst of COVID. I mean, the CEO of my company is saying that don't look for anything to be nearly like it was before until probably the end of 2022. So we're going to be living and dealing with these for quite some time. And I've already heard of violations, like, and not done in any wrong thinking way, but you know, like an employee has tested positive for COVID and a manager tells the team that so-and-so is positive. That is so not the right thing to do, but they're not trained, right? The majority of employees just aren't trained. And that's where it comes back to Susan, policy, procedure, communication, because this is all new to so many people. So that's kind of a long-winded answer, but we've got to be really mindful as information professionals to understand exactly what's happening to that data, who has access to it, et cetera. So Susan, I don't know if you want to comment on that.
Well, I want to talk about the playbook research that we've done. So I don't really have a specific comment to what you said, but at some point I'd like to talk about the research we did to get the playbook done.
Okay. So what Susan's referring to is the best way to prepare for anything going forward certainly is to create a playbook. And I'll let you explain how you got to it. But this now comes back to the COVID records, the records that are being created, the data that's being created as a result of COVID health surveillance, sanitation records, all the things that organizations need to understand in order to protect themselves against risk. So Susan, go ahead. Why don't you do that? We're getting close to the bottom of the hour. So please describe your empirical research.
So early in the pandemic, I asked myself, I wonder if organizations are going to be ready for what I expect to be a very large influx of pandemic-related information. And I was particularly interested in case and contact tracing. So I signed myself up for the Johns Hopkins University contact tracing course. And I am a certified contact tracer. And I have to say that I guess I should have known better, but I was shocked at the kind of personal information that contact tracers are going to be asking for. This is just a few questions. Who lives in your house with you? With whom have you spent time in the past week? Where have you gone in the past week? How much time did you spend with people in your home, and how much time did you spend with people outside your home? It's very personal, very confidential. There may indeed be medical information that's transmitted, communicated during this contact tracing. And honestly, this contact tracing is just one kind of information that's going to be a result of, that's one type of pandemic related information. So what I did is that with the support of Access Corporation, I established a COVID-19 records research group. It was comprised of 9 information governance professionals in 8 industries. There were people from banking, an electronic transmission company, oil and gas companies, banks, and 1 airlines. And we sat in, there were just 4 meetings this summer. They were virtual meetings. And we started by, first of all, identifying what are the records that we expect to be received or created. And in the end, we identified 41 specific, unique record types that are related to the pandemic. Oh, and I do want to mention that that all of the meeting notes and testimonials and all of our work this summer was anonymized. These companies simply could not have participated had we listed their names. So we just used their SIC codes to identify their companies. Once we identified the 41, and that was our job to them, our task in the first meeting, they went out to their organizations, and in the end, we identified 41 unique types. The next task we did was we evaluated them for risk by 6 different criteria. We evaluated them by privacy and data protection concerns, regulatory concerns, legal liability and litigation, record retention, volume, because the volume of information is a huge component of deciding what policies and procedures and processes you're going to do to take care of them. And finally, archival value was the 6th criteria. And a third of those 41 were related to the human resources function, which is not surprising. But practically every business function and organization gets involved. In our study, there were, we've got accounting and audit, communications, environment, health and safety, facilities, ITS, and legal, and they all have pandemic-related records for which they're responsible for. So the next task, we wanted to develop a retention schedule for those, and Access Corporation has a team of half a dozen lawyers that work on this every day. They do the legal research, the legal and regulatory analysis, looking at the privacy requirements, and they went through all 41. And fortunately, so the good news is that 32 of those 41 can fit into existing buckets in the retention schedule. And some of those are ones that Sue was mentioning, like waivers of right or claim for liability to third parties. A lot of contracts and agreements with third parties who may be custodians of screening data, cleaning, visitor logs, salary protection records, CARES Act compliance documentation, policies and procedures, and of course those things that you did expect, the case and contact tracing, the health information related to employees and contractors. There was a completely separate category for health information for visitors and third parties as well. So the 32 fit into some existing bucket in retention schedules. 4 were brand new, and when things are brand new, that is riskier than if things can, for retention purposes, then records that fit into an existing category. Because if you can put something into, for example, an accounting bucket, there are probably processes and procedures already in place to take care of this. However, for those 4 that were totally unique, 2 of them were around testing. We made a separate record series for positive tests and a separate record series for negative tests. The positive tests are retained longer than the negative ones. The other 2 were those 2 health information, the one for visitors and third parties, and the 4th one was employees and contractors. And the retention that recommendations were made by these attorneys based on US federal law and California state law, because California's bar for most things is higher. We didn't do all 50 states. And so we have those results. And Sue, I think you actually, these 4, the positive results were based on a termination of employment plus 5 years, as was the health information termination plus 5 years. The negative tests were just a flat 5 years, and the health information for visitors and third party was a flat 5 years. And Sue, I think you had some information about life of crises. Why don't you mention that before I go on?
Yeah, I mean, I don't know that those states or those governments have really come up with the retention rules that your team is recommending, right? I mean, that's not law yet. So what I've been talking about with our customers is really, it's almost, there's no one size fits all. It's company by company. And one of the major banks that probably most of us do business with in some way or other they've decided that they're going to keep these COVID-related records for the life of the crisis, however long that might be.
Regardless of the kind of record?
The life of the crisis. They have a high risk, profile, and we know that they would expect that there'll be some litigation at some point in time. So they're saying life of crisis. That doesn't mean just for the pandemic either, by the way. That's life of any crisis now going forward, if heaven forfend something like this happens again. But I've had another very major large bank with 250,000 employees say 1 year. So all of this is being done with their stakeholders, with legal, with HR. And by the way, the one that's life of crisis is actually saying that they're depending on HR leadership to declare when the crisis is over. Not legal, not medical, a CMO. Boeing has a CMO, chief medical officer, who would. But it is interesting that we're seeing not surprising that we're seeing organizations take this into their own hands, because there isn't any law yet, per se, right?
Well, it's about managing risk, balancing the risks you take by getting rid of things sooner, avoiding data breaches, and so on, versus retaining them life of crisis. I mean, that's a long time.
Yeah, well, but in the United States now, it's hung up in one of these omnibus or bills that are on the floor now, but they would like to limit that statute of limitations to 5 years for any sort of liability or litigation related to COVID, so that it doesn't go on for generations to come, that they want to put some stopgap measure in place to do that.
I'm wondering if I could jump in with a question. So this is really fascinating. I think one of the issues that this raises in my mind is, you talk about a large bank that's got an army of lawyers and a team of HR experts. What do smaller organizations, how do they decide what's best when they don't have this army of lawyers and this team of HR people, and they're trying to do the best they can? Where do they turn to be able to make good decisions for their smaller organizations that they're in charge with when they're dealing with these records?
Well, one place they can turn to is this playbook that we're producing.
Yeah, but Susan, they don't know about that. So there's a whole realm of small businesses and mid-market, most of the time when we're talking about customers are enterprise level, right? They don't have that kind of support that the dean is talking about. And I think it's a very valid question, because when you go into a pub in London, you go into a restaurant here in Rhode Island, you give your name and your email address, or your name and a phone number, and you're giving it to a kid, who's working that night. They're writing it down on a clipboard. What happens to that? Does it go out in the trash after, I think it's 21 days, certainly in New Orleans. I can't remember what it is here, maybe 14 days. A restaurant they don't even have like admin people to even monitor and say, okay, it's the 14th day, I'm now going to put this in the shred bin. It could go out with the French fry oil for all we know, or it could go home with them. So that's, and I agree, Susan, that the playbook will give people, again, advice, right? You're not saying this is it. You've got your phrase,
Disclaimer.
you're saying that this is just advice only. But that's the bigger question, honestly, Dean. It's like that's why I was excited about doing this roundup, because how can we be more of a voice, perhaps, to reach those segments that don't have the consultative support that Susan's clients do and my clients do, whether that's reaching out to a chamber of commerce or to someone within the state to say, at least here are some basic rules. NARA has done a nice job. They have a very comprehensive FAQ that is easily located, which is really one of the first entities that I've seen be more declarative about what to do. Most are just sort of sitting back and not knowing, and they're not getting direction. So wherever we can help to do that, to provide that kind of, hey, at least think about this, that awareness, I think that is more of the role that we can give back at this point in time.
So, another question that pops into my head, maybe Susan, you could answer this one. So you, Susan, you and Sue both are in positions of influence because you've got access to both resources and knowledge, but also the organizations. What advice might you have for our students, the people in Kieran's classes right now, how to set themselves up that they can be themselves in a position like that, that they've got the right resources and they've got the right kind of influence when they're starting out in their careers, so that they can be able to, as you said earlier, Sue, some of these decisions were being made not including people with any kind of information background. How do they start to make choices now that will help them be part of that conversation and be part of those decisions when whatever comes up next after this hits them and their organizations?
Sue, go ahead. I'll follow you.
Ours is never a very influential profession, I'm sorry to say. It's getting better. Certainly getting better now that we're shedding this notion that records and information management professionals only work with paper. That is just phased out, that the generational sort of issues around that seem to be dissipating fairly quickly. And you can see that in the demographics of ARMA and AIM and the other associations. But what I would recommend our students to do is learn the technology, read about the technology, understand what AI and ML can do, how it works, what the benefits are, what the value is. Just ask the questions. Don't be afraid to ask the question. We've got to be more forceful in how we protect and are the custodians of our organization's data and records. We shouldn't just be sitting back and letting others make the decision. We've got to be more strategic. And the information governance framework certainly is a fantastic guideline for helping someone coming into the profession to understand that it's all interconnected, that you cannot not talk to IT and work with IT, work with security, work with privacy, because data is the lifeblood of our organizations, and it isn't just the domain of one function. And if we can just make sure that we let our students know that they have the right to sit at the table because they have a unique knowledge, then we've got to just insert ourselves and be more assertive. But don't hesitate to ask questions, but really do your homework. Listen to the webinars, the product webinars, the educational programs, what Karen teaches, what Pat teaches. Take it all in and be confident. So Susan, you were the professor, or excuse me, you still are.
I'm just very pragmatic, and the inspiration really for this playbook was so that somebody didn't have to be an expert, that they could take this playbook and just like this 41 record types, take it to your organization and go through speaking with various entities throughout the organization to find out which of these 41 record types your organization is going to have to figure out, and then help them sort through that. So for example, one of the organizations in our study does contact tracing. The others did not say they didn't, but I don't think most companies are going to do their own contact tracing. I think they're going to leave it up to public health. So, tick through the 41 and find out which are pertinent, and then go to work figuring out, helping IT, helping HR, helping them solve the problems around these specific records. And another way to use this playbook is as a benchmarking tool. So this is what these 9 organizations are doing in these multiple industries. How are we doing against that? And I think that it gives you a place to begin your work. There's pages of narrative to help you communicate with the various business functions, because it's not just going to one entity. It's like Sue was saying, it's a collaboration. And I think to get to the table, you have to bring value. And I think that's the challenge, is bringing value to those discussions. And as Sue said, that's not always been easy to do. For example, one big lack we discovered is that in business continuity plans, disaster recovery plans, the records and information are not usually mentioned. You know, there's no attention given to what are we going to do with the records? How are we going to protect them? How are we going, you know, so on and so forth. So there's just a lot that there's just so much awareness that needs to be brought to this problem of information management. And that's our missionary work and our education work that we have to do, self-education, and then extending that to organizational people in our organizations to help them sort through these very complicated problems.
And I have to add that it's not made any easier by being distributed, right? Not being in an office to work together, because we're just not there, and that makes it harder to establish those connections if you're not known to certain other functions, right? So you have to be even more dogged in your persistence to make yourself known to these stakeholders that you may not have worked with before, like facilities, like health and safety, as opposed to the traditional legal compliance, you know, perhaps privacy, probably security. It's not making things easy.
Well, another thing you and I both do is industry groups, and individuals and organizations can do this too, to find ways to communicate with your peers in the same industry. ARMA offers that opportunity, but you don't have to. I mean, it's something you can do yourself. You can, and you do that. I know you have a very important banking collaboration that you do, Sue. Utilities have a very important industry group. They meet 4 times a year, and they share. It's very confidential. No information is shared, but it's so helpful to meet with other people that do the same thing you do in the same industry to find out what best practices are. That doesn't cost money. That just takes initiative to sort that out and participate. I think that's very important.
That's a really good point. Pharma has their own. Certainly the banks have their own. I mean,
legal has their own.
Yeah. So find that group and ask to be part of that group.
And even within a city, I mean, if there's nothing going on, you can make it happen. You know, meet for. I was going to say meet for lunch. That's not going to happen, is it?
No, you can do that virtually.
Yeah, virtual lunches.
Although it's not a lot of fun watching people.
I know.
Yeah.
On Zoom.
Dean, did you have a comment?
Well, we've got about 10 minutes left. Why don't we open it up to questions? We've got a number of participants here. I'm sure some of them have questions. So if people want to uncloak themselves and turn on their video or just turn on their audio if you're more comfortable with that. I don't know if we had any questions in the chat or if anybody would like to just go ahead and chime in with a question.
None are in the chat, but I think we're a reasonable size group. So if someone wants to unmute and uncloak, I think it'll be okay. No, don't uncloak. Turn on your video.
Nobody undress on cam. Kieran, I think you have something, and then maybe Christian.
Ask about procurement, because just looking around the university and seeing how quickly the university was able to procure tools and services across campus that normally would have taken, you know, years to try and negotiate. And I wonder how much backfilling we're having to do now, because we just didn't have the time to think about issues around data privacy in a way that we would have before COVID. So I'm just wondering, like, how much work we're having to do to backfill, given that we had to respond very quickly and get people working from home quickly without maybe some of the checks and balances that we're used to.
I do know that I was just moderating a discussion with someone from CIBC about that topic in Canada, and they didn't have but a handful of employees who had their own devices. So when everybody went home, they had to do a complete inventory of who had personal devices that they could use for work, who just didn't. And then they had to go through the procurement process of trying to find those devices. And whether it's 50,000 MacBooks or 40,000 laptops, for a period of time, there was a shortage. I couldn't find them, right? I mean, you have relationships with partners like Dell or HP fortunately, those people got in line first, but that whole deployment and that supply chain around procurement was big. And the other thing around procurement was just vendor resilience, right? Because you may have vendors that you've lined up to store your records, whether it's in the cloud or in some facility, and suddenly the pandemic hits and those facilities go dark and there isn't a way to get the data back. So one of the things that came out certainly around operational resilience as a result of the pandemic really is understanding your vendors' resilience and their resilience, that chain of who provides as a data processor, as a data, whatever, really understanding until you get to the very end, who's responsible for your success. And I don't think there was enough attention paid to vendor management from an information management perspective, rather than perhaps someone who could provide you with hand sanitizers. So that was a pretty big takeaway. And the other two elements of that operational resilience were obviously business continuity and really looking where all those gaps lay, and cybersecurity, which we've talked about already, just being so vulnerable in so many new and different ways. It's just not a few people working remotely, it's everybody working remotely that now suddenly is target. But that's a really good question for sure.
I have just a general question, because I'm no longer in the business world, but my assumption has been that when the pandemic hit and companies, large and small, had to go to work from home, that communications issued from the company or the employer and instructing how to properly conduct the company's business when you're working from your whatever, garage, bathroom, or whatever. And I had just assumed that all the instructions and, for example, you said do not, you can't print, but that the copying of the digital communications and all of that would be mastered from the company. And it sounds like that's not necessarily the case. I mean, I would have assumed that when a company has procedures with regard to how long emails list and communications with vendors and blah, 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 that would not have changed.
Yeah, but Christian, that's a records retention schedule. That isn't how people are actually performing the work, which was the challenge with sending everyone home. So you're absolutely right. And you're a lawyer, so you know this. There, as Susan said, that's the policy, and that was in place. It's been in place for years, decades, right? And it's updated, and there are new ways of keeping it updated now. But the challenge was, you send all these people home who traditionally worked in an office with a file cabinet and being able to go next door and ask, your neighbor, what about this? What should I do next? Or you're the next in line for processing this loan. All of that went home. I mean, it blew up. And where the gap was really quite clear is that a lot of organizations who don't typically have people working from home had no policy to say, here's now how you work. So really fascinating. One of the first webinars that my educational series at Iron Mountain had was around COVID record keeping. And we had 1,700 people register and 900 show up because, and these weren't just individuals, these were people, records and information management professionals across the spectrum of verticals. So including government. It was all just brand new. It was that way of working. It wasn't like the rule set and you do with this HR record. It was now, okay, how do I do all this at home? How do I keep these things secure? I've got kids running around here. I've got the dog chewing on something over there. And I'm working in a closet. And my spouse is at home and he works for my competitor and we've got to be in different rooms. I mean, there were so many things that nobody ever anticipated that it took a while for organizations to come up with that best practice. And again, that was a collaborative effort between security, privacy, legal, HR, you know, it really was a melting pot in order to give them the proper instructions for what to do working from home.
One of the responses.
Susan and then Kieran.
What?
Susan and then Kieran.
One of the responses has been increased use of collaboration, of content services and collaboration spaces. So many organizations are using MS Teams, Microsoft Teams, which, Sue, what does Iron Mountain use? Do they
Google,
use Teams?
G Suite,
What?
G Suite, Google.
And I think that a lot of effort wasn't put around establishing rules for that. You know, it just wasn't used as heavily. It was in place before, but people are communicating information, they're recording meetings, there's documents, there's data, there's just so much information. And I don't think there's a lot of controls around that yet. That's probably a next task we have to deal with, is getting controls around that as well.
Yeah, and there are people scrambling to get on those collaborative tools because they weren't yet using Office 365.
That's right.
And they weren't using Google. So that's all part of that digital acceleration. Yep. But Kieran, you had something.
Well, I was just going to give the example of the university where people, faculty, staff tend to have a lot of control over their own records, particularly when it comes to storage. We don't tend to do a lot of centralized storage. Everything is backed up, but that's when we were in the office. So I'm still getting email saying that my office computer is getting backed up on a regular schedule, but my home computer isn't, and that's where I'm doing all my business, right? So there's this notion of things need to get pushed back to the user, and the user has to be thinking about these, but it's not quite reached that stage everywhere, particularly in environments where there is a lot of control given to the individual and everything's been set up to control records given that you're in the office, but now you're just not in the office.
And that's a big gap. I mean, you can just see trouble coming your way, Karen, right? And
yeah, I mean, my what I've been doing is basically putting things into UT Box because, you know, I'm realizing, well, I have to now proactively manage my records because I don't have the university stepping in and backing up my home computer. And so, but, you know, to what degree do the rest of the folks on campus know how to do that kind of basic records management work?
You're a subject matter expert. You're savvy, but does someone in the School of Nursing know that? Right? Probably not consistently. And that is something, yeah, that is kind of scary, right?
And that'll all catch up with us sooner or later. It may not be this year, may not be, you know, it'll all catch up with you.
Wow, that's sort of doomsday, Susan.
Well, and that's why we need more information professionals out
Indeed.
there, right? So that we have people who are able to deal with this.
That's right.
And that's where the iSchool can really, yeah, the iSchool can certainly, I would hope, give guidance to what's going on in the 40 acres.
So we're coming up on 7 o'clock, so I think we might want to start wrapping things up. Are there any last comments you'd like to make before we wrap up?
I have one. I always have something to say. As Susan would say, you're very verbal. So, but I just wanted to say that one of the things I think is really, and this is like not going back to the way it was ever, is cultural and how we now, how that's going to change the culture of where we work, whether it's a university or whether it's a law firm or, you know, some Boeing, it's going to change because we're not in connection or communicating the same way as we used to in person. And you onboard a new hire, you're not walking them around the office and introducing them to people that virtually they may never get to meet because they're in a completely different function. And it's that network that can always provide you with more opportunity within an organization. So I really do think that we're going to see some cultural changes, and I think it'll be interesting to monitor or track that. So that's my closing remark.
I think Lucia's actually had a comment if you want to join in.
Yeah, so I'm a new student and I'm a nurse and I'm at a big hospital, and you know, we have a database on all of our new patients, but COVID is something where I'm still looking for a piece of paper somewhere that shows the person's COVID status. And I was talking to one of the database people, and they said that the problem with COVID that's actually going to appear farther on is that the spectrum of problems associated with the virus is so great that it's not like having a box for HIV positive or not HIV not positive, because it can affect so many things. So they're having a problem trying to figure out how they're going to design it into our databases, because just saying someone was COVID positive or was not is not going to be helpful. So it's a lot of things going on, and the thinking at my hospital is also that HIPAA is going to change, because COVID is because it's so contagious. You know, the old thinking that you can't talk about know about someone else's status may no longer pertain, because you really may need to know about what the person next to you, whether they are COVID positive or not.
Or vaccinated, right? I mean, even beyond that, that's really, really interesting, that long tail of what to anticipate as a result of COVID-19.
I mean, lots of unintended consequences reverberate out. Any last thoughts, Susan?
I don't. I think I've said it all. Thank you.
Okay. Well, I'd like to just, I think that we've seen tonight that we have to keep moving forward. You know, our tagline at the iSchool is changing the future by engaging the present and preserving the past. I think this conversation shows how we've got our feet stuck in the present, but we're thinking about the debt we owe to the future in terms of how we preserve these records, how we manage them, how we make sure that everything's kept safe and reliable, and that people are kept safe. So I want to thank our guests, Susan Cisco and Sue Trombley, for sharing their wisdom with us, and Dr. Kieran Trace, Shannon Hickson, and Jess Isaacs for making tonight possible. We'll be making this available afterwards, so some people will have seen this live, other people will be watching this later. If you found tonight interesting, whether you're watching it now or whether you watch it at a later time, I would encourage you to follow the iSchool on social media, to bookmark our page for future events, such as other information roundups, research colloquia, poster sessions, our online open house, and many more. We've got a lot of big plans here at the iSchool. We're about to launch a new undergraduate program in informatics that, pending final approval next week, will bring undergraduate majors to the iSchool starting next fall. We plan to really stay at the forefront of what it means to be an information professional. We're not using COVID as an excuse to pause what we're doing here. We're trying to move ahead and continuing to change and continuing to be at the forefront. If you support the kind of work that goes on here at the iSchool and would like to make a gift, Shannon Hickson's on the call and would be happy to schedule a time to talk to discuss opportunities to invest in our students and our research and in the future of information. The development team is also going to provide some resources to registered participants after the event and make sure that you know about future things that are coming up. For now, let me personally thank you for attending. I look forward to seeing you again in the near future, whether it's on a Zoom webinar or whether it's face-to-face sometime down the road. That's all I've got. Shannon, do you have any last comments you'd like to make before we wrap things up?
No, just want to say thank you. And Sue, I love brainstorming with you. And so this started from a good conversation with Sue Trombley. And then now we're in information roundup, looking forward to the next ones, because again, our goal is to just really promote the intelligence and scholarship that comes out of the iSchool and share it with the world, because apparently they need it. It's a lot going on. And so that's all I have. Thank you so much, everyone, for participating.
Thank you, Shannon.
Thank you.
Thank you, everybody.